You wake up, swallow, and instantly feel it. That thick, sticky weight at the back of your throat. You cough, you clear it. 30 seconds later, the feeling is right back. You might try sipping warm tea, dissolving honey, or adding lemon, but the relief is temporary. The heaviness always returns. When you finally ask a doctor about it, you likely hear a familiar dismissal. It's just a normal part of getting older. But the throat is rarely the source of the problem. That constant mucus is a highly logical biological response. Your body is producing it to defend against a hidden irritation happening somewhere else entirely. To fix this, we have to look at what mucus actually does. It is your respiratory system's first line of defense, designed to trap dust, bacteria, and airborne particles before they reach your lungs. This diagram shows your body's natural airway clearing system, called mucociliary clearance. These tiny hair-like structures are cilia. They beat in a continuous rhythm, sweeping a thin, watery layer of protective fluid up and out of your airways. Research confirms that past age 60, these cilia beat slower and weaker. A thin fluid layer that would have cleared in minutes at age 40 can now pool and linger for hours. Because this natural conveyor belt operates at a slower pace in older adults, any trigger that forces your body to produce extra mucus hits harder and stays trapped in your throat much longer. The most statistically common trigger for extra mucus originates in your digestive system. It is called laryngopharyngeal reflux, or LPR, and it operates very differently from standard heartburn. This diagram shows the esophageal valve. As we age, it weakens. While sleeping, gravity fails to keep acid down. Microscopic droplets creep upward, reaching the vocal cords. To defend itself, throat tissue aggressively secretes a thick layer of protective mucus. Carefully, the diagnostic trap is the lack of obvious symptoms. Up to half of LPR patients experience absolutely no chest burning or traditional digestive discomfort. Night after night, your throat silently fights an acid attack while you sleep. You wake up with heavy mucus pooling at the back of your throat, unaware of the digestive battle that caused it. The second trigger happens just above the throat. When we picture sinus problems, we usually imagine throbbing facial pain or blocked breathing. But in adults over 55, chronic sinus inflammation is frequently quiet. Instead of painful congestion, mildly inflamed sinuses produce a steady, unnoticeable trickle of fluid. Over an 8-hour sleep, gravity pulls that fluid down, steadily accumulating it at the back of your airway. When people feel this, they often grab over-the-counter antihistamines. The flaw in that approach is that antihistamines simply remove water from the mucus, leaving the underlying inflammation active. Dehydrating the fluid creates a stickier, denser layer of mucus. You end up with a far more uncomfortable airway block by morning than if you had taken nothing at all. The third trigger hides in plain sight, inside daily pill boxes. A widely prescribed class of blood pressure medications, known as ACE inhibitors, carries a very specific, documented side effect. This diagram illustrates the mechanism. ACE inhibitors block a chemical pathway to lower blood pressure. This causes a secondary compound called bradykinin to accumulate. In older adults, high bradykinin levels act as a direct chemical irritant to the throat. The connection is frequently missed because of a delayed reaction. This localized throat irritation often doesn't show up until weeks or even months after a patient takes their first pill. What appears to be a brand new, age-related respiratory decline is frequently a delayed pharmacological side effect, completely unrelated to your actual lung health. The final cause relies on two factors working together: inadequate internal hydration and dry indoor air. As we age, the human thirst mechanism becomes significantly less sensitive. You can be meaningfully dehydrated without ever feeling the urge to drink a glass of water. Think of mucus like honey. Warm, well-hydrated honey flows easily. Dehydrated honey turns thick, sticky, and slow to move. Your body's fluids behave the exact same way. When you combine unnoticed internal dehydration with the dry air pushed out by indoor winter heating systems, you create an environment that guarantees your throat's natural defense response stays stuck and highly inefficient. Because these triggers are structural overloads, they respond best to strict, non-prescription structural interventions. This visual compares flat sleeping to an incline setup. Stopping food intake 3 hours before bed ensures an empty stomach. Then raising the headboard slightly actively uses gravity to keep remaining stomach acid safely below the throat while you sleep. In the morning, drinking a glass of warm water immediately rehydrates tissue and thins pooled mucus. Following that with a daily warm saline nasal rinse actively clears out quiet, low-grade sinus inflammation. If you take blood pressure medication, book a review with your doctor. Ask them if you are on an ACE inhibitor, and inquire if alternative classes, like ARBs, might lower your pressure without irritating your airway. Certain warning signs bypass self-management entirely. If your mucus is tinged with blood, if you experience unexplained weight loss, or if you have difficulty swallowing, you must see a doctor immediately. But barring those red flags, the vast majority of persistent throat clearing in older adults is a benign, mechanically triggered reaction, and that means it is entirely fixable at home. Take Margaret, a patient who spent 2 years constantly clearing her throat. After carefully analyzing her timeline, she simply adjusted her blood pressure medication, raised her bed frame, and drank warm water. Within 6 weeks, an issue that plagued her for years dropped by 80%. Your symptoms are precise biological signals waiting to be decoded. Once you understand the mechanics of your own body, you can stop being a passive passenger and take the wheel again.